Urinary catheters can sometimes be inserted with consent during your labour and birth for various reasons, but what are some of those reasons? What's the risks and benefits? And if you yourself had a urinary catheter put in, let me know in the comments below what the reason was that it was advised for during your labour and birth. Hi, I'm Angie, I've been a midwife for the last 13 years and you can hit the follow button for more pregnancy, birth and parenting information. So as a starting point, most women should be encouraged and advised to wee as often as they possibly can. Sometimes that baby's head coming down can actually block the urethral exit and stop the woman from feeling the sensations of needing to wee, which is why it's really good to go as often as you possibly can. It's also a good way to get you up and moving. That baby rotated sometimes in a better position for labour and birth. But encouraging you to be able to go and wee helps you to do this on your own without the need for a catheter. Now, for some women, they are unable to pass urine, they are unable to wee during labour and birth. Sometimes that's because baby's in a back-to-back position, for example. Sometimes it's just what's happening in labour. Sometimes it can also be a sign of obstructed labour too. Sometimes if the baby's not coming down in that pushing stage, a catheter can be recommended, and that's because a really full bladder will stop that baby from descending in the pelvis, and I've done other videos on that before. Other reasons for recommending a catheter during labour and birth can also be when the baby is out, if the placenta is taking some time to deliver. Again, you are unable to pass urine. Again, sometimes just emptying that bladder can mean that there's more room for that placenta to come through and then deliver, either physiologically or with the assistance of the injection for your placenta. Sometimes that catheter will also be recommended to try and manage a postpartum hemorrhage where blood loss is too much after birth too. And then sometimes it's to monitor your fluid output because you've got something called preeclampsia, which is really important to be able to monitor how much you are passing urine to monitor your kidney function too. For women and people who have an epidural during labour and birth, often a catheter is recommended either as an indwelling where it stays in, or an in-out catheter depending on how far into labour you are. This is because with an epidural it's harder to get up and be mobile. Sometimes you can be offered bedpans, but sometimes it can be hard to know if your bladder is fully empty. Having a full bladder can also stop an epidural from working effectively. It can also stop that baby from descending. It can stop contractions, it can space them out as well. So often with an epidural it is recommended to have a catheter of some sort, whether that's one that stays in or comes in and out during your labour and birth.